Do you know the signs of multiple myeloma? Did I know the signs of multiple myeloma? Chances are, for most people, the answer was no. And when I was diagnosed, I never knew about it. I didn't know what it was. I didn't know how to spell it. I had no history of it. I didn't even know it was a thing. So let's just get into it. Uh, my name is Chad Y. Royer. This is my channel. What's up with Chad Y. Royer? I talk about my diagnosis as a cancer patient and a cancer survivor. And we are in the final day of March, where March is Myeloma Action Month. And advocates like myself ask for the hashtag to be shared. More than myeloma. I have it right here. More than myeloma. And if I could just think now, because I've gone through a lot before I had the diagnosis, and the question is out, did I know the signs? Well, according to the International Myeloma Foundation, who I credit for the information in this video, thank you, International Myeloma Foundation. You can follow them on Instagram as well. Latest statistics show that 70% of the signs exist before the diagnosis. In fact, let me do better. Let me do better. I'm going to read it verbatim. Don't ignore your body. Fatigue, infections, bone pain, shortness of breath. 70% of patients felt the signs. I felt the signs without knowing what it was. So just think, that's 7 out of 10 people felt the signs without really knowing what it was until they were diagnosed. So in my case, fatigue, I felt. Bone pain, I was dealing with. Shortness of breath, not so much, but that is a documented symptom. And the glaring number here is 70%. 70% of people have had these signs of the cancer. Because the thing is, you don't feel the cancer, you feel the results of what cancer does. And how I was able to get around to knowing what it was, it started with my doctor. My doctor told me that my blood levels look kind of wonky. Maybe she used different words. They were funny looking, that some levels were off, and I should get a second look. I didn't really know what that meant. But for the most part, I was in okay health. It was only a matter of time that other symptoms materialized in greater and severe form, like the pain in the bones, the sciatica, the tiredness, the fatigue, the lack of energy, the sharpness of pain in specific areas. Like for me, it was the back, it was the knees, it was the ankles, and then sciatica pretty much exasperated everything. So when I went to my pain management doctor, I was getting epidural shots. And it was the last shot that I got that I realized I was able to retain some ability to walk, but not full range of motion. And the pain kind of shifted, but I was at least able to do things a little bit independently. But this was different. That pain came back with a vengeance. And I knew that something else was going on that the epidurals could not solve. All of these were signs. All of these were signs of a cancer that would run all over my body and do a lot of damage. This happened to more people than I know. I mean, I don't know anyone personally who went through this, but anyone who has had the diagnosis has a story that's similar to mine in some way, shape, or form. Because that's what multiple myeloma does. It multiplies cancerous cells in the blood that develops from the bone marrow, and it directly attacks the bone structure, the femur, the bones, the ribs, the backbone. It left lesions and fractures, which was causing my pain and my immobility. Had I not gone to the doctor, or to the ER rather, I wouldn't have had the blood test for them to see what was wrong and how bad the numbers were. I was referred to the oncology team from the ER where they looked at everything. So, what am I saying from a person who had the signs and did not know what it was? I know I'm pretty sure most of you may not know it unless you're in the field. But it's very important to get the blood tested. You must get your blood tested. You must make your annual visits. Whenever there's something going on with your blood, that's always an indication of something going on in the body. Ask the question, what are the odds that I may have a cancer in my system or a blood cancer? What are the odds that I may have irregularities? Can I have a referral to an oncology team to rule out the possibility that I have some cancer-like situation going on in my system? Ask the question to your doctor, especially if you're over the age of 45. Because when I found out about it, I was learning that people around late 50s or 60s and 70s were getting it predominantly, but I was an outlier. I got my diagnosis at 48, much younger than most people, but now more and more people are getting the diagnosis. We got to ask the question to our medical team, to our doctors who we see. What are the chances? What are the odds? If there's no issues with the blood, because what will happen, you will have abnormal ranges of anything affecting the liver, the kidneys, your calcium levels, your blood cell counts. All those things came into play when they had to figure out what I had. So again, I credit International Myeloma Foundation for this glaring fact that 70% of patients felt the signs. I'm speaking with a sense of urgency because there are 30% of folks who got the diagnosis but didn't feel the signs. Maybe that number is bigger, I don't know. But let's share the awareness of what multiple myeloma does. Let's not keep this hidden. It happened to me. I don't want it to happen to you. On this note, I thank you all for listening. Please share my channel, subscribe to get notifications, leave a comment or two. I'll be happy to hear what you have to say. While we are in the last day of Myeloma Action Month or Myeloma Awareness Month, which is in March. Please share the hashtag more than myeloma, learn something about it, and help our folks make better decisions when it comes to their health care. You be safe. You be well.